Good evening, ladies and gentlemen, and welcome to Delegate Bagnall's virtual town hall. We are in the penultimate virtual town hall meeting here of the series, and we have one more next week, which we'll tell you about towards the end. But I would like to welcome you all here. Thanks so much for joining us this evening for this virtual town hall, which will be talking about women's reproductive health care. We do have some fabulous guests with us, and I'll let Delegate Bagnall introduce them to you. Just a couple of bits of housekeeping before we get started. The participants on this town hall, as it is informational, will not be able to unmute themselves, start their video or chat. If there are any questions for any of our panelists, please feel free to email them to us at heather@heatherbagnall.com, and we will field as many of the questions as we can in the time that we have. Other than that, I have nothing else to do other than introduce our fabulous delegate, Delegate Heather Bagnall.
Thank you so much, and thank you for joining us tonight for the 5th of our 2022 legislative session virtual town hall series. I'm Heather Bagnall, your delegate in District 33. I first wanted to thank you all once again for your continued commitment to our community as we experience yet another surge. As we transition from pandemic to endemic, I know many of us had a brief sigh of relief as the vaccine was approved for our under 5 population. As we are seeing a relaxing of restrictions, I do want to thank you once again for taking the common sense actions which keep our community safe, our businesses open, our children in our school buildings, and our live arts alive. Before we begin talking about reproductive health policy, I want to give a bit of context for tonight's discussion. As with all of our town halls, tonight is an educational discussion on policy, not a debate. The Maryland General Assembly worked on a broad range of policies addressing the full spectrum of women's reproductive health care, much of which went relatively unnoticed with great attention paid to the potential decision of the Supreme Court. And tonight we are going to attempt to touch on the broad spectrum of work we did. But we cannot operate as though the historic decision by the Supreme Court did not happen. So tonight in this brief hour, we will also look at not only how Maryland prepared for this decision, but the reality of its impact. I am honored tonight to be joined by 3 extraordinary women who have been on the front lines of women's reproductive access, healthcare, and liberty. Heather Bagnall is a former delegate, now congressional candidate for District 1. She is a policy expert, a farmer, and the founder and CEO of a nonprofit organization focused on bridging the partisan political divide. Ariana Kelly, Delegate Kelly, is the former chair of the Health and Government Operations, Health Occupations and Long-Term Care Subcommittee, an expert on addressing women's health care, workforce development, network adequacy, former president of the Women's Caucus, and now vice chair of the Health and Government Operations Committee, and the sponsor of landmark legislation, including the Abortion Care Access Act. And Robin Elliott is a policy expert and legislative liaison for a number of health and provider organizations. If you haven't yet done so, please be sure to subscribe to my social media. I primarily use Facebook and Twitter for immediate information, and so as not to clog up your inboxes, but I do send updates on events and issues within the community. I try to be as brief as possible, but brevity has not always been one of my strongest suits. I do want to thank you all for being here and for your help, your advocacy, and your desire to be more informed about our reproductive policies. I especially want to thank our congressional partners who have been working side by side with my office. I'm going to keep this event this evening to an hour to respect your time, because I know we're all a little zoomed out. So I'll attempt to answer all questions, but if we can't get to your question on the call, we will circle back with you to make sure you have answers. If you do have a question and you have not submitted it in advance, please feel free to email your question to heather@heatherbagnall.com. And I also want to thank my chief of staff, Caroline Hecker, and Luke Todd-Ball, who consistently work behind the scenes to make me look far more tech savvy than I am, and always on top of every issue. With that, I am honored to introduce Heather Bagnall. Welcome, and thank you so much for being here tonight.
Oh, Delegate Bagnall, thank you so much for the invitation. I just love you and your style of service to the community so much. You just are so available, so reachable, so in touch with the community, sharing good policy information and stitching the community together to be this meaningful voice all the time. Thank you for offering a service like this to your constituents. This is what public service is about, and not enough leaders do it. And that's why I always jump at the chance when you ask me to collaborate with you, because it's always a great dialogue. And I just apologize on the front end to all of your guests tonight that I won't be able to spend the whole time with you, but I'm excited to be here for at least a brief chat on the federal perspective of this. Setting the stage, I can speak to what we all know and felt all too closely to our own hearts that happened on Friday. June 24th is going to be a date that none of us soon forget, a day when women became second-class citizens in this country again, and rights that had been settled law for more than 50 years were taken back from us by 6 unelected Supreme Court justices in Washington, D.C., defying the will of the supermajority of people in this country, and on very shaky legal standards, it would seem as well. And as we know, while we're in Maryland, can breathe a little bit of a sigh of relief about having our protections in our state because of the great work that you and Ariana Kelly and all of the great leaders that you'll be discussing tonight on the call have done in Maryland to protect and preserve rights in Maryland that we can still build on in our Constitution. We have forces at work, both nationally and in our federal congressional delegation, that want to claw back what we even have here in Maryland. And they want to go for a full federal ban. And of course, our response to that is absolutely no way in hell. And not only are we not going to go back on the protections that we have here in Maryland, we can't rest until we codify Roe versus Wade into federal law. I'm as frustrated as anyone else that it has taken us this long to get to this point. We all probably should have seen the writing on the wall for encouraging us to engage and do this at the national level. But it also just seemed like until it happens, you really don't believe that something like this is going to take place, even though we've been working and engaging and being the fiercest advocates we can be to always protect our rights, always highlighting what's at risk every election if we don't make sure that we all engage. And so this has gotten really real for a lot of folks. And I want to say thank you, because I know that you and Delegate Kelly and others in the Women's Caucus are on the front end of not just protecting what we have here in Maryland, but thinking through, okay, what does this mean, not only for access to the women in our state, but for the women who are going to try to come into Maryland. And I know you're going to have a robust conversation about that today. At the same time, that we are all dedicated to making sure that through this midterm election, as well as the elections to follow, that we put everything we have into electing leaders who are unequivocally on the side of allowing women to make our own choices about our own bodies. And that there's no scenario where we're going to give an inch on this. And that there's a lot of creative thinking happening right now that we're going to be looking to find consensus on ways that at the national level we can have stopgap measures in the states that have the trigger laws. How can we support providers to work with women on self-induced medical abortion assistance? How do we make sure that healthcare covers these things? What kind of childcare and travel vouchers can be available? Every tool at the policy lever at our disposal on policy needs to be on the table at both the national and the state level. And it's more important now than ever that we all come together to collaborate on these approaches, the best ideas on what needs to be done at the state level, how federal partners can back this up, all the while absolutely working 100% towards the goal of codifying Roe and passing the Women's Health Protection Act, which we've passed in the House, and continually keep running up against the challenge in the Senate and the filibuster rules there that I support eliminating immediately so that we can move forward. So we've been caught in a situation where electoral politics has kept us from making the advances that we need at the national level. And we always know that there's another election around the corner that can help us take care of that. And I want to say to all the women on here that I'm giving it everything I have to get rid of our anti-choice zealot in the Maryland federal delegation. Andy Harris doesn't even want exceptions for rape, incest, or life of the mother being in danger. He wants everything on the table as a ban right now, and we can ban him. We can get him right out of here. And I know that many of you are excited to do that. So in addition to all the, what can I do? How can I be involved? I know you're going to let folks know how they can engage on the state level, both the things that we're holding on to in Maryland and how we want to help other women. And for any of you that want to knock on some doors and get involved in the midterm election to defeat our anti-choice congressman who still remains in the Maryland delegation, you can reach out to heathermizzier.com is our campaign's website, and we'd be happy to put you to work in a meaningful way in that regard as well.
Thank you so much. Thank you so much for being here. And I know part of the reason for our viewers that Ms. Mizzier can't stay on the call the whole time is because she is out there, fighting to make sure that that we are putting pro-choice candidates in office. So I really appreciate you being here, and I really appreciate you bringing up the midterm elections because in light of what has just happened. And the fact that our elections moved time frame there, we had redistricting. People are still confused. We actually did a town hall on the new districts just to try and educate our community to know, when they were happening, how to find out where they were, if they had questions, who to even contact. So I really appreciate you bringing that up because I think there is a really important intersection between good comprehensive policy and getting people in office who will support that good comprehensive policy. So I just want to thank you so much for being here tonight.
Oh, thank you. And yeah, for a hot minute, we were going to be in the same congressional district with each other. We actually did some Zooms within that period from December to March where Anne Arundel was in the first district. And even though I won't have the honor of representing a part of Anne Arundel in this district, at least for the next 10 years, I do want to say that we are all one here in Maryland, and every district is a part of this state that we cherish. And this state has always stood for freedom and choice and allowing for women to make these decisions on their own. And we're not going to step away from that. And we're going to make sure that as a unified voice, we are a delegation that carries that message at the federal level as well. Thank you so much for all that you're doing and for all who are engaged in the call tonight. Will do as part of the citizen army to protect, preserve, expand all of the rights that we refuse to go back on. Roe, but we saw in Clarence Thomas's opinion, they don't want to stop there. They want to take it all back. And we just absolutely can't let that happen. And thank you for calling us to our best selves and engaging with each other to stand up for our rights.
Well, thank you. And I know you have to run off to a number of other events. So I just really appreciate you taking the time to join us tonight.
You're welcome. Now I'll change out. I put this shirt on just for you and your town hall because, I love messaging through my clothes. And if anyone else wants one of these t-shirts as well, Emily's List sells this as merchandise, and when you buy it, it goes towards supporting more federal pro-choice candidates across the country. And I'm also honored to have Emily's List endorsement in the campaign. So go get your Emily's List pro-choice gear, wear it proud, speak loud, and I'll see you guys out on the campaign trail. Thank you so much.
Thank you so much. Delegate Kelly, what I feel like we can sort of encompass women's reproductive health care with 2 words. It's complicated. Because even as we're talking about the impact of this latest decision, we haven't even talked about the complicated and broad spectrum of reproductive services and legislation, and even what reproductive health care looks like, at the reality of the policies and the breadth of policies that we have worked on, that you have led the charge on, and Delegate Bagnall have been really very much on the front end of to Ms. Mazir's point, sort of looking ahead and understanding all of the equity issues, the parity issues, the gaps in services that we needed to look at even before this decision was sort of coming down the pike. So thank you for being here tonight in what I know is going to feel like a very brief town hall for the breadth of information that we're going to cover.
Well, I have to start with a really brief story because Heather Mazir just left us and I was remembering. Heather is a dear friend and I served with her for 4 years. We overlapped. And when I was a baby legislator, brand new, she handed me this bill. It was a midwife licensure bill. And she said, I don't have the capacity to do this. And senior legislators often take new members under their wings and teach them how to do things. She says, trust me, this bill is the right thing to do. You should do it. It took me 5 years to pass that bill. So I love Heather with all my heart. But I saw her and I was like, oh, speaking of reproductive health care, like the first really big bill I did was licensing the direct entry midwives in the state of Maryland so that people who wanted particularly home birth options had so in a safe and legal way. Boy, that was a political fight. And we've come a long way because you had the licensed clinical midwives bill just the other year, right?
Mm-hmm. Because I think so much of that is about educating not just the community on what these are, but even other legislators. Because we're not all experts in all things. I know, when I first joined the Health and Government Operations Committee, I was like, "Are you sure?" And then I was there, and it became very clear that this was the right place to be because I loved understanding the policy. But these are comprehensive policies, and we do have to work with the people who have the expertise, and also sort of look at every policy through that equity lens, but also through the unintended consequences lens.
Mm-hmm. Yeah, absolutely. Did you want to talk in specific about some of these reproductive healthcare policies we've passed in the last couple of years, and we can look at that equity lens?
I would, because I think there are issues that keep sort of coming back each session. Things like the fact that we've had this high maternal mortality rate, that we were really looking at how we could broaden our access to labor and delivery services. We've got workforce. We've had some workforce issues that we've had to look at even before we were looking at, okay, how do we, protect our reproductive liberty and protect a woman's right to privacy and dignity and autonomy? How do we also ensure that that whatever a woman chooses, that she is going to have a healthy reproductive process?
Right. And one of the things that we always have to look at, right, to your point of unintended consequences, sometimes something can seem like a great idea. And when you think through it and you talk to the stakeholders in the health policy community, you can really understand it's never as simple as it seems when you first come up with the idea. So that being said, and I'm excited we have Robin Elliott here today because she is a master of the wonkiest, nerdiest, complicated details of health policy. There are so many things in the last couple of years that we have done on reproductive health care that really has made Maryland a leader. We have, to the point you just made, done a lot of work trying to close gaps in maternal mortality. We did a lot of work maybe a decade ago, and we found that we were able to reduce maternal mortality, but largely for white women. And we realized that these disparities were just growing. So we have really honed in and focused on making sure we're closing those gaps and getting the resources where they need to be. And that, I think, is one of our top priorities in Maryland. We also were, I think it was in April of this year, went into effect 12 months postpartum for Medicaid, which is incredibly important. We know that I've had 2 children. That year after giving birth, your body is in all sorts of disarray, and making sure that mom and baby have continued coverage during that time is really critical for addressing both maternal mortality, but also long-term health. Which brings me to another thing, which I think is really important, which maybe we don't necessarily think of as a reproductive health care bill. But this year in Maryland, we passed the Time to Care Act, which includes a lot of different types of leave for caregiving and other personal health reasons, but is a state maternity and paternity leave program. And we know having time off at the birth of a child is so important for giving someone the ability to recover after giving birth, reducing their stress throughout their whole pregnancy. If you know that you have paid time off coming at the birth of your child, your stress levels are lower throughout your whole pregnancy. So it's not, it's an economic policy, but it's also a public health policy to ensure that we have parental leave. And that's something we were able to do in Maryland this year, which I was so excited about.
I absolutely agree. It's something that occurred to me, even as we were having the debate on the Abortion Care Access Bill, and I really want, the Abortion Care Access Act, and I really want to give you the opportunity to talk about the breadth of that bill, because that was, when we talk about comprehensive legislation, that was a comprehensive, omnibus bill when it comes to reproductive care and access to safe and legal abortion, but also to the provider community and what that looked like, and sort of undoing some of these more draconian policies that weren't medically based. And when we talk about that, there was another bill that we were sort of having the debate hand in glove, and that was the Healthy Babies Act, which again, sort of ended a policy that was not medically based. And when we talk about wanting to provide for healthy babies, that bill really addressed a disparity in our law, which was quite shocking to even see that there was opposition to it. Do you want to speak to the legislation, or do you want me to frame it out?
Sure. I mean, I'm happy to. Just briefly, the Healthy Babies Act, which was our chairman, Jocelyn Pena-Melnick's bill, and she is such a champion on these issues. It ensured that Maryland Medicaid covers maternal care for people regardless of their documentation status. And this is really, really huge. In Montgomery County, we had a program that solved things for this population, and you could see, right, the disparities throughout the state, as opposed to Montgomery County, which had this unique program. It's unconscionable to think that we could have pregnant women who wouldn't be eligible for maternity care, and blue states and red states across the country had already adopted this policy. It was not a partisan issue. I think it shouldn't have been in Maryland either. And the data that was presented to us in the committee about healthy birth outcomes and long-term impacts for those children who are born, it was made it very clear what the right thing to do was to pass that bill. I don't know if you wanted to say anything about that. I know that bill was really meaningful to you as well.
It really was, because I think the lesson from COVID was that COVID doesn't care. COVID doesn't care about your economic status. COVID doesn't care about your immigration status. But Healthy Babies we really want to provide as many tools as possible for healthy outcomes. And when we saw the data, I mean, it was shocking that we hadn't done it already. So I really appreciated our now chair of the Health and Government Operations Committee and really being the champion of that bill. And I think, having that legislation, as well as, I mean, I had a bill that expanded access to menstrual products for low-income Marylanders, because again, we had done a lot in Maryland for period poverty, but we hadn't really had anything for this particular population. We looked at incarcerated populations. We had looked at schools. We had looked at homeless shelters. And this issue actually was brought to us by a young constituent. She was, an adolescent constituent who said, this is a real issue in our community. And there's been federal legislation for 6 years on the books that hasn't passed. So Maryland, again, is a leader in this, creating this framework. So we created a framework for that. We passed the bill for paid family leave for the healthy babies, for 12 months of postpartum care, and we passed the comprehensive abortion care access bill. And I think that was, we saw the handwriting on the wall, and we prepared. And I think we really sort of led on this issue, and you led on that issue as the sponsor of the bill. And I think, again, when we talk about educating the community and educating our legislators, that was so much of that work. I know there were a couple times when you said, I just can't even talk anymore because, I'm so mentally exhausted.
You're bringing me back to the good old days of trying to get that bill out. It wasn't easy, huh? You remember, Heather? So, it's interesting because we had passed, I think it was in 2018, the Contraceptive Equity Act, which was a piece of legislation that made Maryland first in the nation for access to contraception, which with no cost sharing. Interesting sidebar, that piece of legislation covered vasectomies with no copay, no cost sharing, which was huge. And now I'm seeing one of the results, just anecdotally, it was reported that, someone did a really brief survey that vasectomy requests are up 300 to 400% since the Roe versus Wade decision. So the fact that we were able to cover not just contraception for women, but also vasectomies in that bill is even more important now. But when we did that bill, we really learned about what Maryland could do in terms of leading in these reproductive healthcare spaces. And we approached the development of the Abortion Care Access Act the same way. We wanted Maryland to be a leader, to be a beacon, to figure out how, basically to look at our abortion law, which had been frozen in time for 30 years, right? We passed Question 6, which codified the principles of Roe versus Wade 30 years ago in a statewide referendum, which was supported with more than 60% of the population. And then we hadn't touched the law since. But as you know, as well as anyone, the environment for healthcare has changed dramatically in the last 30 years. How we deliver care has changed. What types of providers has changed, and how we pay for that care has changed. So we needed to modernize the law, and we basically came up with the vision that would allow us to provide not only safe care, but affordable care to patients in Maryland from an increased number of providers who were distributed geographically across the state and had racial and ethnic diversity, so that we could really meet the needs of all the other healthcare issues we've been talking about, right? Those health equity issues and geographic disparities in access to care and things like that. So the bill was designed to apply best practices of healthcare policy to this very political issue, which shouldn't be political, which is abortion care. Basically treating abortion like healthcare instead of a political hot button.
And I really appreciate that approach, because it is healthcare, and it's also a civil rights issue. I think that's where so many of us struggled. I mean, I think this decision on Monday just it rattled so many of us, even those of us who, you know, I mean, we had passed this bill in preparation for it. We even had a potential referendum bill for the ballot in anticipation of this eventuality. And yet, I think the reality of it, just sort of extrapolating out the impact of this decision and all the things that we had done, but all the things that we haven't done. For instance, the governor withholding that funding, which was supposed to move us towards building out our network adequacy to address an influx of women coming into Maryland. And can you speak a little bit about what that piece looked like and what the impact of the governor withholding that funding has been on Maryland?
Yeah, so this is really disappointing to me. As I mentioned, we really tried to root this bill in best practices, right? And one of the things we knew we wanted to do was increase the number of providers by allowing advanced practice clinicians, nurse practitioners, nurse midwives, physician assistants to provide abortion care. And
that's because abortion care, as you said, has expanded. Medication abortion is a thing, and I think a lot of people don't understand exactly what you know. They always hear these stories, these horrific stories about later term abortions without an understanding of why those abortions happen. That something has gone wrong. That medication abortion is you know the majority of I think it's more than 90. Yeah, it's like a large majority of services, and that the providers are the same providers that would provide miscarriage management.
Exactly. So we had a law on the books that said you had to be a physician to provide abortion care, but a nurse practitioner or a nurse midwife could be doing the exact same procedure for miscarriage management. So that's why it was sort of a political restriction on the books as opposed to one rooted in best practices of healthcare policy. So when we removed that politically based restriction and opened the doors as of July 1st to these other highly qualified clinicians who have abortion care in their scope of practice and are already providing this care in 14 other states, you know, we wanted to pair that with access to training. We wanted to make sure that not just these physicians, but also any doctors, family practice physicians, OBGYNs who had not been providing abortion care in the past, who wanted access to training to provide abortion services in light of what we saw happening with the overturn of Roe versus Wade, would have access to training so that they could be providing high quality care to the people of Maryland. And so we funded this clinical training program, which is a first in the country, but we were not able to mandate that spending for this coming fiscal year. Instead, we had to use this complicated budgetary process and basically fence off the money, which means we earmarked it for this program for this year. It's required to be spent for this year if it's spent. But the governor is instead right now choosing not to spend it at all. And it's just going to sit there. It's going to be in this special fund for abortion clinical training. So next year we'll have 7 million instead of 3.5 million. But now when we see like on the news every day, clinics closing across the country and patients brokenhearted, not knowing what to do and needing our help, we're not going to release this money. It's unconscionable to me. I try not to think about abortion in political terms, right? I know that people have really personal feelings about this issue. And I know lots of people on both sides of the political aisle who believe in abortion rights, right? It's unconscionable to me to not release this money when there's people who need access to healthcare and we could help them.
Thank you so much. And thank you for all of your work on this bill and on this issue. And I want to turn to Robin Elliott because I think, you know, we saw this coming. We saw this as a potential. We tried to prepare for it. We tried to create as comprehensive as possible protections. And yet here we are. And I think the reality of what is happening on the ground is starting to hit us even just within, a matter of days. So thank you so much for being here to walk us through this.
Absolutely. And thank you, Delegate Bagnall, Delegate Kelly. Just to let the viewers know a little bit about myself, I am a policy consultant and lobbyist. One of my clients is Planned Parenthood of Maryland. I also work with nursing organizations, including the American College of Nurse Midwives. And I am a proud Anne Arundel County resident. I am just a smidge over in 30, so I'm not in your district, but I can almost look across the water and see it. So, the Abortion Care Access Bill, if we hadn't gotten that through the Maryland General Assembly, and of course we did because we have such great leadership, Delegate Kelly, Senator Dolores Kelly over in the Senate, we would be in a very difficult position right now. In Maryland, even with the fact that abortion is legal here, we have been behind the curve, as Delegate Kelly cited, in terms of access. So 2/3 of our counties right at this moment do not have a single abortion provider. That is about to change because of the Abortion Care Access Act. And as a result, we will see providers in every part of the state. We will see nurse practitioners, nurse midwives, physicians who in their actual everyday practices can integrate and offer abortion care. And that is really because of that abortion care training piece. And that is so important for women in Maryland. It is also critical for the parts of our state that border other states. We are at risk in Pennsylvania. Ohio has already banned abortion. We are the closest state for some women in Ohio to get safe abortion care. So it is really, really such an important piece of legislation. It is the most comprehensive bill in the country. And so, but we know that we will be thinking about how to do more because this is a public health disaster we're in the midst of.
Thank you so much. And I echo your words. I think a lot of us were pretty speechless the other day, just thinking about the impact of this and the reality. I will say, outside of a policy issue, I do view this as a civil rights issue, and the Supreme Court has also they have made it clear that they also view it as a civil rights issue and that it's a precedent that could unravel other civil rights. And we have to look at that comprehensively. But even more than that, being rendered sort of a second-class citizen, I texted my colleagues that morning, Monday morning, when I realized this was going to happen. And I said, I can't believe that I'm going to end this day with fewer rights than I began it. And I think that's just a shocking place to find ourselves. But I also think that it's very frustrating that it seems to be a regular thing that women have to share their most personal traumas to defend their own access to their autonomy. So I know we're trying not to make it political, but it is emotional. The reality of it is very emotional because there are so many reasons why women need access to abortions, why families need access to abortions, why family planning should not be left to legislators who have no stake in the outcome. So what are you seeing, Robin, from the provider community? Because some of these trigger laws aren't just about about banning abortion or limiting abortion, but they're actually about scaring the providers out of providing these services. So what are you seeing from the provider perspective? Like, how are Maryland providers doing? How are other states doing in light of this latest Supreme Court decision?
So I think providers in Maryland, first, I have gotten so many texts and calls and emails that they're just so thankful to be here and to be able to continue to serve women and clinicians who provide abortion care. They're providing abortion care because it is from the heart, and they know and understand that being able to access this healthcare service is life-changing and life-saving. So they are, providers are scared. And we are looking at providers in other states. I have a very, very close friend who's a family physician in Ohio. She is scared to death. We are looking at providers who are going to be facing not just the vigilante litigation passed by Texas. It is a trend now that states are looking at criminalizing providers who provide care under any circumstances. So we are going to have, unfortunately, physicians and nurses and people who help them looking at felony penalties or homicide penalties. So it's very, very serious. And so in thinking about moving forward, it is doing everything we can to protect our providers.
And it's, ironically, I had the bill this year for reducing violence in the workplace in healthcare settings. It was to create a work group to work on a public campaign, because and for those of you watching, it actually came from the Maryland Nurses Association. Initially, they had 4 years ago talked to their members to say, what is the number one priority for you? And it was to reduce workplace violence. And they went through a strategic plan. They have sort of done everything they can. They've put additional security measures in place. They've done de-escalation training. They have hired more security. They have protocols of how to escalate a situation. And they still came to the Maryland General Assembly and said, we've done everything we can think of, and now we need your help. We need public buy-in. And when we talk about intersectionality, we can't ignore the other Supreme Court decision that came down, which expanded access to concealed carry firearms. And I bring this up because there was a report in going back to 2001 that the number one cause of death for pregnant women was in fact murder. And I believe those numbers have come down to a degree, but it is worrying to see this access expanded while our access to our reproductive care is diminished. And I don't really have a question. I just think it's important that we understand there is an intersection there as well, and that it's important that Maryland do everything we can to sort of keep those two decoupled as much as possible. And I'm sure that though we don't necessarily want to say it, is on the minds of the providers as well.
Yes, I mean, I think at the core, what the Supreme Court did on Friday has nothing to do with healthcare. It has everything to do with control of women's bodies. And the fact that the Supreme Court, many of the justices now consider themselves originalists or strict constitutionalists or whatever the terminology. When we look at the history of abortion, abortion was allowed. Back when our Constitution was formed, there was never any consideration of any restrictions. Those came much later. And they had to do with a group of physicians who wanted to push out midwives. Just wanted to cite that, since both of you have worked on legislation ensuring that women can go to the providers that they want to go to. And so if we look at all of this, this whole issue is about control. It is not about healthcare. And that is why I think, Delegate Kelly is so right. Maryland, we have the opportunity here to create legislation that then can get what's imitation is the best form of flattery, hopefully carried on in other states. Not only is the Abortion Care Access Bill first in the nation on a lot of things, we were the first state to require contraceptives to be covered by insurance. That was back in 1986. Delegate Kelly's bill in 2016, the Contraceptive Equity Act, very first state in the country to require over-the-counter contraception to be covered, and talking about like making sure we meet people where we are. That's very important. And then we were also the first state to say no to President Trump on his Title X restrictions, which had everything to do with pushing abortion providers out of providing family planning care. So there is a lot that we have done. And if we think about all of the hard work ahead, know that what we do affects Marylanders, of course, central to Marylanders, but is also very important for the rest of the country.
If
Thank you.
Can I
Yeah, go
jump
ahead.
in a second, Heather? Because you're
Absolutely.
Thank you. I as we're talking about health equity and maternal mortality, and guns, I just saw this statistic as I was preparing for a different event that you're absolutely right that murder is the #1 way that pregnant women die. And for Black women, they are 8 times as likely to be murdered when they are pregnant. So forced pregnancy is not going to help with that problem.
Thank you. Thank you for making that point. And also thank you, Robin, for saying Friday, because I think my brain is still processing. I think I've said Monday a couple of times, and it's been less than a week since we became second-class citizens. So I'm still adjusting. But I know there's more to do. And I think a lot of times folks view me as a little hair on fire for my district, and we hear a lot, talk local, talk about those kitchen table issues. But I think this is a kitchen table issue. I think the reality of our reproductive health care, our liberty, our ability to choose when and if we have children is actually central to every part of our lives, every part of our our family planning, our economy, our childcare, our workforce. It's one of the things that we saw even during the pandemic was, to your point, Delegate Kelly, about the paid family leave, is that by and large, the workforce, 80%, in fact, of the workforce that left during the pandemic and did not return were women. And they were women who either didn't have child care or found that they could adapt their economic, their family economy to provide for their families without taking that second income, because they were then still the care providers for the family.
Absolutely. And I will just say that that's why Janet Yellen and others are sounding the alarm. This is going to have a huge impact on our economy. And we can't ignore that. And the other thing in response to what you were saying earlier that I really want to elevate is this doesn't just create risk for people who are unintentionally pregnant. It creates risk for people who have planned, wanted pregnancies. There's a state senator from a rural part of Georgia who I saw on the news the other day, and she said it brilliantly. She said she'd been pregnant 10 times and she has 2 live children. These decisions in women's lives are so personal. They're so deeply personal. And what she said was, this is going to have a profound impact on people's ability to bring healthy children into this world. And I think we can't lose sight of that either, because when I think about what I'm most afraid of, it's, I think about all of the people across the country who would potentially suffer due to this. And I think of my own daughter, and I think of, how does she move forward in making that choice to have children the way that I did, when we can't guarantee her that she is going to have safe and effective miscarriage management care. If she has an ectopic pregnancy, we can't guarantee her she's going to be treated. If she has a problem pregnancy that risks her life, we can't guarantee that the United States government is going to value her life. It's just terrifying.
It is. And behind this decision, we have the other decisions about, will we lose access to contraception? Will we lose access to these other rights? And I think that is where we have to look, not just as legislators about what we can do, but as citizens, because we are not without means to push back. And as I said, this is probably the most political town hall I'll have, but I think it's critical. I think it's critical in this time to make sure that we're really educating and engaging our constituents on the impact of doing nothing. And I think that, even though Maryland feels safe, to your point, Delegate Kelly, to your point, Robin, that we have done a lot, and we have created that framework for other states, that allows other states to simply duplicate what we did. We also have to ensure that they do, and that we make sure that the majority of Marylanders and the majority of Americans are speaking to the fact that they want this access to remain, and that the people who are trying to remove access are a vocal minority, and in many ways an unfortunately misinformed minority, because the impact of this decision isn't fewer abortions, it's unsafe abortions, and to your point, Delegate Kelly, fewer healthy children and fewer healthy mothers. So I know we're coming up on time, and I'm getting the cue, but I want to give everyone an opportunity to sort of have some final thoughts, next steps. And I'm going to do a big pitch for the primaries, July 19th, early voting, July 7th through 14th. You can do same day voter registration. We have mail-in ballots. We have ballot boxes. If you have any questions, go to your county board of elections. They will tell you everything you need to know to make sure that you have access to that ballot, because that's how we keep our access to our own autonomy. And I hate that we have to fight for it, but to not acknowledge that reality, I just think puts us in greater jeopardy. So Robin Elliott, final thoughts, next steps, what can we do?
So final thoughts, I think very much voting and civic engagement, absolutely at the top of the list. This Friday's decision, see, I'm doing it, was the result of decades of the anti-abortion movement planting people at every level of government. The other thing I just wanted to say is I think the number one thing that we can do every day is to talk about abortion and speak the truth and not stigmatize it, because that's what they want us to do. They want us to be ashamed, and they wanted to push it underground. And we have the power in just talking about it openly and not stigmatizing it, and to supporting people telling their stories. We have the opportunity to push back every single day. So thank you for having this town hall.
And thank you. And that's a really important point. Thank you so much. Delegate Kelly,
Oh, I love
final thoughts, next steps.
I love listening to Robin Elliott. She makes me feel empowered. So thank you, Robin, for your final thoughts. As you were talking, I was just, reflecting on, that's what they want. They want us to feel stigmatized. And having read the Supreme Court decision, which was a hard read, it upset my stomach, every line. It was dripping with contempt for women. I mean, contempt. They absolutely wanted us to feel ashamed. They absolutely wanted us to not feel as though we deserved to have the right to make our own choices. The tone of the opinion, people have talked about it a lot, but I think most people haven't read it and don't need to. But believe me when I tell you that that is not a Supreme Court that is reflective of almost anybody's values that I know, including people who are opposed to abortion. Like, it was really mean-spirited and had no regard for women's lives. So I agree with Robin that the way we counter that is by talking openly and freely and acknowledging that women's lives matter, right? We're not just gestational carriers or potential gestational carriers. We are human beings and our lives matter. And then the other thing that I would say, having been through passing the Abortion Care Access Act this year, is that it's really important, even in Maryland, really important that we hear from constituents who support these types of bills. I think that sometimes people get complacent in Maryland and think that we're safe. And so they don't need to voice themselves with their local officials. And that is not the case. We have a lot of champions like Delegate Bagnall, but we need to hear from constituents that these are the policies and this is the direction that Marylanders want to be moving in. So it's really important that you get involved at the community level, join groups, send emails, communicate with your legislators. Obviously, if you're watching this town hall, you're active and engaged. Make sure that we are hearing from you on these important issues, because that's going to make a big difference in the years to come.
Thank you so much. And I have to get used to Vice Chair Kelly. Thank you, Vice Chair Kelly. And I think that's really important, especially, to your point, in some of these battlegrounds, some of these purple areas. It's true that we'll hear. We often hear from the people that are most opposed to what we're doing, and it's important because we want to make sure that we're being representative of our constituency and our community. That we hear from the community that these are important issues to you. And this is a crisis moment where if you are not being heard, do not allow yourself to be ignored. I don't think we should be apologetic about demanding our own civil rights. And I will leave it there and turn it over to Luke. Thank you all so much for joining us tonight, for being part of this conversation. I can't thank my guests, Robin Elliott, Ariana Kelly, Heather Mazier, enough for being here and for being on the front end of this moment. I don't think any of us who ran for state office saw this as a potential on the horizon. But this is where we are, and we're not going to allow ourselves to go back any further.
Well, thank you so much, Delegate Bagnall, also Delegate Kelly, Vice Chair Kelly, of course, and Robin Elliott, and of course, Heather Bagnall, for joining us this evening, and thank you to all of you who are here in the Zoom with us, and also our guests on YouTube. So if you you're watching this after the fact, as it were, on the YouTube channel, please do check out Delegate Bagnall's website at heatherbagnall.com. You can also check out the other representatives, Delegate Ariana Kelly and also Heather Bagnall, on their websites and social media. Please do follow them and keep in touch. If you need to find out who your elected officials are, you can check out the voter information tab on Delegate Bagnall's website, which has all the links that you will need, including the ones how to check your voter registration, of course, which you'll want to do before the primaries, all the appropriate dates, and also how to request a mail-in ballot or absentee ballot, as we used to call them, the vote by mail anyway, on there. Do please remember to do that before July the 12th for the primaries. That is the deadline to do that. But otherwise, we do have one final virtual town hall next week, and I hope you'll all join us for that. I'm excited to say it's about education, being an educator myself. And it is talking about the blueprint and also everything educational. We have two fantastic guests that will be joining us, which is Dr. Joanna Tobin, who is president of the Anne Arundel County Board of Education, and also Mr. Clarence Crawford, who is the president of the Maryland State Board of Education. So please do join us for that next Wednesday at 6:30 p.m. Tell your friends and family to join us also. Otherwise, have a great evening. Thanks for joining us, and we'll see you again soon.